TelScope actually takes your smart device, whether it be an iPhone, Android, and turns it into an intraoral camera. So it's a very simple system. It has a handle with a USB charge, 2.5 hours on a charge. It is antimicrobial. And then you have these little single-use blades, and it illuminates when you connect. So it's very simple. And then I'm going to go ahead and share my screen. And I'm going to show the new provider app that we just created with Teledentix. And so in the back of the screen, the back of the phone, you just connect like that, and it just looks like that. So I'm going to go ahead and launch the Teledentix app. And as you can see, from the front of the screen, it has everything that you would need to run your business at the fingertip. So it has your appointments, it has your network. So like all of your providers that you refer business to, right there. And then also at the bottom, you'll see the little patients. And it has all your patients right here as well. I'm just going to go into Abigail, and you can see all these buttons here. You have a call button where you actually can do a live Zoom with your patient. The capture button, that's actually where TelScope resides. And then you have a chat, text, mail. Record button is kind of interesting, where you can actually have a personal message to your patient, kind of a patient satisfaction thing, or add any information for them to help with their treatment. And then prescription, and then medical alert. So I'm going to go ahead and hit the capture button and launch the TelScope app. So on the very right, the solid button with the circle around it, that's where you can do video, 10 seconds of video. The middle one is stills, and then the one to the left is your catalog, where your images reside before you upload them into the patient's file. So I'm going to go ahead and take a couple images. All right, and then I'm going to go into the catalog, and those images are residing right here. And so I'm going to go ahead and select one. And you see the tool button at the bottom there. It actually has all of your functions right there. So if you have an area of concern that you want to circle, you can do that. And then there's a label button where you can actually annotate. And if you want to erase, you just hit the erase and you just slide over the top and it'll erase. So I'm going to go back and circle. And then I'm going to go ahead, and you see there's a little arrow to the left. You just hit that, and it'll actually upload directly into the patient's file under images. So I'm just going to go into the images really quick and show you where they are. So they're time-stamped, and now you have these available real time, because it's in the cloud. It'll actually be able to, the dentist on the other end, if it's a hygienist scenario, he'll be able to see them, or she will be able to see them real time, and be able to help with the treatment of the patient. Also, I wanted to just go through a little bit about the app as well. You can view the patient's profile, appointment history, completed calls, and this is all at your fingertips on your phone. And then the images, obviously that's where the TelScope images reside. Patient information, you can upload information to the patient. You can provide videos, treatment plans, general progress, educational information for the patient, and that's about it. So Michelle, did I cover it all, or is there anything else that I missed about the provider app, other than the fact that it's real time? And
no, you pretty much got it. You're a great little user. I love it.
All right. Well, I will kick it back over to Daniel.
Okay, great. Thanks, Mike. That was an awesome presentation. And then for this part, we are going to have Dr. Bill Jackson, our COO and co-founder of Teledentix and Virtual Dental Care, talk about the application a little bit from the provider's perspective, the patient's perspective, and then all in one just from a holistic perspective. So I'll pass it over to you, Bill.
Yeah, thanks. And good evening, everybody. So we're, by the way, really excited to work with Holland Healthcare, having met Jennifer, heard her vision, and what we've seen as we've been working with Holland is that we now have something that kind of completes the circle. I'm getting feedback. I don't know if there's somebody that could be on mute that isn't on the panel. It would be helpful. Thank you. So it was great to meet Jennifer. One of the necessary things to complete the ring of teledentistry is the ability to have somebody holding something really in their hand and completing out the patient or provider connection with the software. We had early on as a company assumed that intraoral cameras were going to be the solution. We built a lot of our application to support intraoral cameras out in the field. This is so much better. And I'm saying that as much professionally as I am just having worked with other people that use this. It's so much easier to use than an intraoral camera. And I'll talk about it in a few seconds, but it's also something that a non-professional can use quite easily. So intraoral cameras, we experimented giving visiting nurses intraoral cameras. They had to carry around a laptop. They had to deal with sensors. They had to do things that they just weren't used to doing, and hence they didn't do it. And now we have a tool that's, frankly, I think it takes as good or better an image given what it's being used for. So at any rate, we again, we're really excited to work with Holland Healthcare on this. And we recognize right away that, if we could figure out how to tie this into our teledentistry application, it would help everybody. And so what Mike just showed you was, okay, we've got this way of capturing an image. Now, what do we do with it? Well, we can put it into a patient record. We can share that record with other people. We can share it with the patient. The patient can download it later and take a look at it all through the application, all immediately. So you don't even have to wait until you've sent it somewhere and uploaded it somewhere. It's there automatically. So again, we've got a web-based app. I'll talk about that just a few seconds, for 3 seconds, in a few seconds. And it ties in with the provider app and to the patient app. Those are two different apps, and they're both fully integrated. The patient has different needs, different user interface, different user experience than the provider does, but it all works together. And as soon as it's up into the cloud, it's into a single application. I can go online then and look into the Teledentix application and see all of this. It is kind of like a mini practice management system. What I'll say is rather than a practice management system, it's a mini electronic health record. It's really rather robust, and we can take the time maybe at some other point if you'd like to learn more about the application to show all the things it can do. And you can see some of the things on the right that it can do, and Mike certainly touched on each of those. You can go to the next slide, Daniel. So once again, we've got this the provider app, which Mike showed. We have the patient app, very specific to the patient. We allow them to once it's hooked up to the TelScope, to the Holland Healthcare device, you can take pictures. You can also, and you saw Mike doing it in a real-time basis. I mean, you could literally remotely, if you're a hygienist in the field and you want a dentist to see the patient live, you can actually stream it the way that Mike was streaming it, and that'll go through the app. And you can, in fact, even take pictures, snapshots as the streaming is going if you choose, and that'll go into the patient record. And again, then you can share that. It becomes part of your patient record, and it goes into the patient portal. And the patient then has access to that too, and anything else that's, that you did. If you did a prescription, if you wanted the patient to see other educational materials and so on and so forth. And we actually even allow the patient to do selfies if they want to at home. And I'll talk about the various usages that we're beginning to even, that we're touching on already, that we're planning on already, and barely a week goes by when we don't come up with another way that the telescope might benefit the dental healthcare world. Okay, you can go on to the next one. So the point here is that we do have a really robust, within Teledentix, a really robust electronic health record. The past company that I co-founded and sold was a company that built dental practice management software. Plant TDS Denticon was the software, if you're familiar with it. And I think that we can say, and Richard Lee, the other co-founder, he and I were in that venture together. And I think that we can say, as far as electronic health record goes, you're not going to probably get any better. You know, we have the ability to have forms. We have the ability to take notes. The forms actually are customizable. And so many people who use teledentistry are mobile, and people that are mobile need forms literally for every location that they go to. So we have very customizable forms. Notes and so on and so forth, and these can be referred, so that if you need to send the records to, if you're a hygienist out in the field and you want to send the records to a dentist, it's easily done. It doesn't cost you or the dentist anything to share those records. So once again, I won't get into it. I could spend the whole rest of the time just talking about the electronic health record, but it's really quite robust. We don't intend to replace practice management systems, although I have to admit, for certain mobile situations, we actually come quite close, and probably in a short period of time, we will have nailed it completely. But generally speaking, this just shows that this is everything, whether it's taken in the mobile app on the patient side, whether it's taken in the mobile app on the provider side, any entries in it go into the web app, and all three are near real time synced with each other. You can go on to the next one then, Dan. So as I mentioned, we keep coming up with different ways that this might be used. So certainly it's going to be used on the professional level. And the professional level can extend beyond just a hygienist or a dentist using this to illuminate the mouth and gather images, whether they be real time or just photos. But we see the value, and we're already talking to emergency rooms where in fact, health plans, medical health plans, Medicare Advantage primarily, that want to keep their patients out of emergency rooms. So potentially they could have, at acute care centers, they could have these, and a patient can go in there, and or it could be done in a physician's office. Certainly every school, I think every school nurse should have one of these. And this is a way that dentists can, in fact, extend their practices into their local community. So extend the footprint of their existing practices by going to schools, school nurses, showing them how to use it, showing the school nurse that, in fact, they can communicate with the dentist live for maybe very simple questions. Maybe the child's just losing a tooth, and you can tell them it's not very unnecessary for them to come in. It can be at senior homes, it can be at community centers, long-term care facilities, nurses, nurses that are going into homes, nurses that are going into care centers. Once again, very simple for them to use. If we ask them, as we had it in our past, ask them to use an intraoral camera, it's just not going to work. And we could go on and on. Medicare Advantage may, from a consumer standpoint, we've talked to insurance companies that may just give these as a covered benefit to the Medicare Advantage folks. So that from home, they can have a virtual care, or maybe 2 virtual care appointments at no cost that's covered by the Medicare Advantage plan. Once again, saving that plan significant amount of money, keeping people out of the emergency room, catching disease in its earliest stages, dealing with chronic healthcare patients, diabetic patients, and so forth, being able to give them dental care on the spot. So again, I don't want to spend a whole lot of time on it, but there is a whole level of consumer use too that we've talked about. But basically with that, I'm going to turn it over to Dr. Simpson and let him talk about some of his visions of how people are using it too.
Thanks, Bill. Yeah, Bill did a beautiful job in covering a lot of this. I did want to expound on this just a little bit. And I mean, obviously, anybody attending this meeting tonight is well aware of where dentistry is and the trend in moving beyond the traditional brick and mortar. delivery of care services, because, for a lot of reasons that we're all very well aware of, there's a large segment of the population that are not being reached, either institutionalized or difficulty with transportation or homebound. We also have a workforce issue in the rural communities. We have close to 60 million Americans that are in a health profession shortage area. And when we're talking about rural communities across the country, in dentistry, and those of us affiliated indirectly or directly with dental schools and the state dental associations, we're well aware of workforce shortages. And dentists are not going into the rural areas near at the rate that they used to. So we have those that are in the rural areas are an aging workforce. Here in Alabama, we have numerous counties with one or no dentist, and those that have two or one dentist. Over 50% of those are age 60 or older. And this is very similar across the country. So we have large segments in the rural communities that do have FQHCs, that do have community health centers, that do have rural primary care physicians and doctors. And many of the states are starting to integrate oral health services, hygienists into these areas. Being able to have dental offices, say a general dentist in a rural community, be able to cover 2 or 3 counties by expanding her workforce, sending hygienists out or coordinating with independent hygienists and rural care facilities, rural hospitals being an on-call service. It really opens up opportunities to be able to take imaging and assess those. We are seeing an increased desire and usage in public health services and doing school screenings and school risk assessments, and then working with community dental hygienists. And as he mentioned earlier, there's quite a few people across the country now that are realizing that there is an entire market and unmet need in assisted living facilities and nursing homes. And being able to capture images in these facilities, oftentimes you're not allowed to use Wi-Fi while you're there. You don't have to have that with this system. You can capture and store and then manage those images later on. And so there's a great advantage in being able to do that. Providing not only emergency assessments, emergency services through the EDs and the urgent care centers, as Bill mentioned, but also being able to coordinate with medical facilities and areas that there, as I mentioned earlier, significant dental shortages. So we're seeing a tremendous ability to do this here in Alabama. And in one area we've got in Northeast Alabama, we have a group of 5 pediatric practices now that have TelScopes. Every specialist that they refer to is 1, 2, 3 counties away. So now they're able to send images to ENTs to get assessments for tonsils, to see if they need to be assessed to have tonsils removed without the parent having to take a day off of work and drive 2 hours to get an initial exam. They're able to refer to their pediatric dentists that are 1 or 2 counties away to do an initial assessment, particularly since the pediatricians are well aware of some of the cases that may be having to go to the hospital. Bill mentioned in the hospitals themselves, a lot of the third-party payers are realizing that there are significant medical savings to be had by addressing oral issues. And many of you are aware that a good number of people that are intubated in hospitals, it's due to aspiration pneumonia and poor oral hygiene, and they're culturing oral bacteria that have caused the pneumonia. And so being able to manage oral conditions for intensive care patients or patients in step-down facilities and in skilled nursing facilities can significantly reduce costs by improving their health, being able to address needs where they are, and then direct and target your care appropriately, as opposed to having to load patients up into the ambulances to get them out of the skilled nursing facilities to the dental office. So there's some more real world experiences that we are seeing and we are having, and we see such great potential for nationwide. Thanks, Daniel.
Great. Thanks, Dr. Simpson and Dr. Jackson. Very good insights there. And then right now, I did want to take the opportunity to remind everybody to ask questions in the questions box. We will have some time at the end of this presentation. But right now, we're going to move on to our wonderful users, Luxury Tooth Booth, Sarah Tanner, and Jolene Caravu from Home Dental to Use. So right now, I'd like to hear from you, Sarah. Go ahead.
Thanks for having me. I'm Sarah Tanner. Excuse the voice. I'm trying to get over this, whatever it is. Yeah, so I've used Teledentix since April. I've kind of established my own platform to what I want. It's been nice having the support from not only Michelle, but Daniel as well as James to kind of establish what would be best for me here in Colorado as a mobile and teledentistry platform for the broad spectrum, Denver metro area, possibly the slopes, things like that, making myself as available as possible to where it can be utilized. Teledentix has been amazing in a sense of just providing an app, for instance. Like I was having issues with my laptop seeing a patient outside their home, and I was able to hop onto my iPad, and it was just that easy. So I love the accessibility, the app function, not needing Wi-Fi, not needing to depend upon that is huge firsthand. My first experience, so Teledentix has been one thing, and then I had a separate experience with TelScope at COMOM, that's Colorado Mission and Mercy, where we saw 650 patients and they receive oral health care services at no cost to them. I happened to work with Susan Cotton and I met Mike there. And Mike was like, hey, I've got a new gadget for you to use while you're here. And I was like, sweet, that's awesome. So the guidance of Susan Cotton, her expertise in oral cancer is impeccable. So I was thrilled to kind of dive in there, learn from her, get firsthand experiences. This was actually in Canyon City, where most of the population was streamlined through their health history form. So they filled out a health history form if they were current smokers or tobacco chewers. They went through oral cancer screening, our section. If they had past experiences or past smoking or chewing habits, then they would come to us as well. We would have the conversation of no judgment, like how are things going? Whenever you're ready to quit, we as healthcare professionals, as well as your medical professional, are here to help to quit smoking. But let's take a look at your intraoral tissues. They change every couple weeks. So let's take a look. So I was able to use my magnifiers, my loupes without the light, and the illumination from the TelScope was amazing. It just kind of illuminated the entire oral cavity. Pictures were taken of lesions. We would tell the patients, hey, no news is good news. We're going to send these over to the oral surgeon in a HIPAA compliant form. Your information is secure, safe. That's also an important thing for me in my practice, is just making sure that I'm staying within the barriers of being compliant and safe, not only for my patients, but for everybody. So we sent those off. At one point, I was like, Mike, okay, I need to get, there's like something going on behind the uvula when the patient says, I'm able to see it. But when she kind of relaxes, I'm unable to see it. So I was like, is there another function to this? And he's like, oh yeah, there's a video function. And I was like, sweet, how do we use that? And he's like, well, I wasn't planning on going into that. And I was like, well, I'd like to go into that and know how to use it. So being able to dive in real world with both the TelScope here with Susan Cotton was amazing. I think I used it at every person in my chair, and I just got so used to it. So the aspirations that I have is to use this in every one of my patients in my practice, just as a standard of care, like I would a perio chart or x-rays. And also for Dr. Simpson, he may want to indulge on what a dentist is looking for within the TelScope. Like, what kind of images would you like? What kind of videos would you like? Just to go into detail to provide us as direct access care providers more insight as to what dentists are looking for. Since they're not in there themselves, what do they want from us direct access providers to provide with for instance, TelScope as an or ability to use that. So other than that, yeah, I love the integration of the two. I've used them within the TelScope app. I'm sorry, the Teledentix app, and it's been seamless. I haven't had an issue. So yeah, I love it. So Dr. Simpson, if you don't mind going into what you'd prefer to see within caption images or videos for us to provide dentists, that'd be great. Thank you.
Sure. Do you want to just save that towards the end? So we've got Jolyn coming up, or how do you want to do that?
Yeah, let's go ahead and let's move on to Jolene, and then we'll
Okay.
we'll have that as a question at the end. But we'll definitely get back to that. Great. Yeah. So Jolene, over to you.
Okay, thank you so much for having me, Sarah. I agree with you. I am overcoming, excuse the voice, and thank you for having me, but I am recovering like many people these days. I am really excited. In 2021, Teledentix was my choice of a software program for my mobile portable dental business in the Tampa Bay area. We were implementing the intraoral camera and a great radiograph system. And Teledentix really rose to the occasion by making it that we did not need to be connected to a Wi-Fi, which can be very challenging and difficult in some situations. And moving on to the next slide. As Sarah was saying that she was using it for oral cancer screening. So moving into 2022, kind of realizing the benefits of the TelScope, and that it's not just going to be an individual capture like an intraoral camera. We're doing a palpable and visual oral cancer screening on all of our patients. But I love the idea that this is going to be a capture video. We can use it with Wi-Fi, without Wi-Fi, and just get a lot more detail. So in Florida, we're supervised by a dentist. So I'm passing all the information from my assessment on to my dentist for him to be able to diagnose, but it'll just give more visual for him to view a video instead of individual captures. So I'm very excited about that. Not only, excuse me, is he looking for next screen there, Danielle, for the oral cancer screening, but it's just an oral assessment and exam. And because primary part of our population is in long-term care and they have a lot of different health issues, we're looking for a lot of different, could be abnormal conditions, and thrush seems to be very predominant in the senior population. And I feel like the TelScope video just is going to give us a better visual of what's going on in the patient's mouth. So it'll be better for patient education. It'll be better for the facility and the medical dental integration, as well as my dentist when he is doing diagnosis for our next step forward for referral or prescription, or whatever direction we're going in. So I am just so happy with Teledentix. I know that we've come a long way in a year, and I'm excited to see where we go in 2022, but definitely TelScope is something that I look forward to implementing with all of my seniors. I hope COVID will slow itself down so we can get back into the facilities. We were doing great up until the holidays, and now we're kind of on hold again, but I'm sure a lot of you are experiencing the same thing. So thank you for Teledentix for just really helping us move forward in a very progressive way. So thank you.
Awesome. And then real quick, I did want to share, so these are some TelScope images that have been taken, and especially for oral cancer, and this looks like tonsillar cancer as well. So as you can see, the high definition illumination really lets you get in there and see it with great clarity as well.
Very detailed.
So with that, I did want to go on to questions. So if you have any questions, please type them into the box. And then we are going to circle back to the question for Dr. Simpson that Sarah had. So what type of images and or videos are you looking for as a doctor when working in collaboration with a direct access hygienist?
First of all, I'd love to state that in Alabama, we have that ability. I would love to be able to have hygienists out remotely, but we're not there yet with our dental practice here in this state regulations, but we're getting there slowly but surely. We're working with the community dental hygienists now, going to public health facilities and nursing homes. But, you know, to touch base on the soft tissue first, you know, really, what I've found that's very helpful is if you come, you know, we'll just kind of, everybody kind of has an image of the mouth in their mind. And so really kind of coming straight on with the mouth open, head tip back, you get hard and soft palate, and then depress the tongue and get the throat, and then come back forward and get a good view of the tongue and retract right and left. And then what I found is helpful when you want to look at the buccal mucosa or the inside of the cheek is not have the blade all the way in, but pull it out and catch the edge of the mouth and retract, and then you can see both cheeks. So I generally like a soft tissue survey that way first. So it's maybe, you know, 1, 2, 3, 4 views, one on each cheek, the tongue, the soft palate and hard palate, and the throat. And then from a dental standpoint, you know, of course, lower arch. And if you're doing stills, you can, you know, capture the entire lower arch, or you can choose to do one side at a time, upper arch. And then it takes about 10 minutes of practicing with this. And I recommend practicing if you haven't used it. Mike is an expert at it and offers free, you know, 15-minute personal demonstrations, which is a great way to go. But he uses a little mirror, and you can practice on yourself at first. But when you're taking pictures of the side of the teeth, one of the things that you may have noticed is you rotate the camera to the side. So that's not intuitive at first, but as you do that, you find that it's very easy. So from a dental standpoint, the dentition, what is helpful for me is have 1 or 2 views of the lower arch, you know, the occlusal surfaces, 1 of the 2 of the upper occlusal surfaces, and then have them partially closed down, retract the cheek, get a full buccal on one side, a full buccal on the other side. And generally you're able to see the lingual surfaces when you do that, but if need be, you can retract the tongue. And one thing I found that's helpful is you can capture, say, the right buccal, have them open, retract the tongue, catch the left lingual, and then cross over to the other side, if that made sense, without moving the camera. Really, you're just shooting buccal, have them open wide, you shoot the lingual on the opposite side, and then come across. So a survey of the occlusal surfaces, the buccal, and then a soft tissue survey is very helpful. And if you want to assess the occlusion, then of course you can have them closed down. The video is a really nice capture. You can start on one side, practice it first, retract the cheek, gently roll across. I think Daniel actually showed 2 quick videos there where you saw that it rolled around, did the whole survey of the lower arch, then you flip it, and then do a whole survey of the upper arch. And in 10 seconds, you get a complete view of the full dentition. So a video is a nice way to capture all of that with fewer stills. And then you can actually take stills from the video, which is kind of a nice way to go too. Particularly, I would imagine if you're working with the elderly, I don't do that as being a pediatric dentist, but being able to get in there and in maybe 2 10-second videos, capture everything as opposed to having to do a whole series of stills might be helpful in some, you know, patients where it's a little more challenging to obtain access. I hope that helps.
Absolutely. All right, thank you so much. So we have another question here, and I think this one's actually best for you, Dr. Simpson, about the benefits of using a TelScope as opposed to a traditional intraoral camera. So any insights you have about that would be great.
Sorry, I was muted. Sure. You know, definitely, Bill, you can jump in too. He alluded to it some. First of all, I would put a bunch of it in a convenience standpoint. Not having to have Wi-Fi, not having to carry a laptop where you're going, not having to be attached to a cord, and then being able to capture larger areas. You know, the intraoral cameras, you know, you're pretty much capturing a more isolated area in most images. You're not able to capture, say, the entire, you know, upper right posterior quadrant, you know, from anterior to posterior in one shot most of the time. Being able to assess soft tissue with this type of device, and you know, retract the tongue. You're able to illuminate. You're not illuminating with those devices, whereas you are with this. You're able to retract tissue, move the cheeks out of the way, move the tongue out of the way, depress the tongue, capture video. So there's the convenience, there's the ability to illuminate, there's the ability to retract, and get more into your image at the same time. And in addition to that, as I say, getting more into your image, you can also zoom in and out. You know, and you can do that as you're filming or taking the pictures. But what I've found is really helpful, since the software actually sets your camera to the ideal zoom. I have found it very helpful just capture the image and then zoom in on your screen to get a better view. And what's really been eye-opening for me is what I think I see with the naked eye, and then you zoom in and you realize you're seeing things that you didn't see otherwise. The imaging is actually better quality than if I were just looking directly in the mouth myself. So I think there's not only the convenience standpoint, but the ability to do certain things in the mouth that you can't do with a smaller intraoral camera. Bill, if you want to jump in, or
that was a good summary. I just add a couple things. One is cost. This is considerably less than an intraoral camera. And then the other thing I would add is it doesn't take a professional to use it. So it could be a nurse at a senior home. It could be a traveling nurse. And intraoral cameras, no matter what you want to say about it, unless you've been trained to work in somebody's mouth, it doesn't come natural. And but you can use a TelScope without a whole lot of professional training. You had great suggestions, Rick, as to how a professional could do it faster. But you know, it doesn't have to be a professional. They'll figure out how to do it.
Awesome. And then on that, Bill, we did get questions about pricing for Teledentix subscription and TelScope. So if you could speak a little about that, and comparing to, you know, traditional practice management softwares and the pros and cons of each would be great.
Yeah, without you giving a commercial, we intended when we started the company to use Teledentix as part of really a whole regimen as to how to treat people that were underserved, that didn't have access to care. And we knew that we had to make it work right for the people in the field, which all in-office traditional software doesn't do. It requires workarounds, and we needed to make it scalable so that you could potentially see hundreds, if not thousands, of locations and different people at locations. And then the third component was we knew that we needed to keep it inexpensive. Dental practice management software is really expensive now. So from our standpoint, we keep it really simple. It's only $35 a user with a 4-user minimum. So basically $140 a month for most small practices, or most small hygiene practices. But we've also worked with Holland Healthcare, and TelScopes are only $99 a piece if you have a Teledentix subscription. So it's kind of unbeatable. I mean, if you're going to go, and with our software, by the way, our image capture, including X-rays, is native, so you don't have to work with a third-party application. You don't have to work with with the problems of integration, although we do have our own problems with integration with sensors. But nonetheless, it's a really affordable solution, hopefully from our standpoint, getting to our ultimately founding goal of how to get access to care to the underserved.
Great. So it looks like, correct me if I'm wrong, I think we've covered all the questions in here. Just wanted to give one more opportunity for anybody to ask any more questions.
There looks like there's one more in the chat from Bob Montgomery. First of all, I think the first part was just a good point, in that, you know, a nursing home, to my knowledge, I don't know what it is in every state, but a nursing home is supposed to contractually have agreement with the dentist. Now, my mother spent 2 years in a nursing home, never saw the dentist, never heard about a dentist, but her son being a dentist, I was able to handle all 3 of her dental emergencies while she was in her bed. However, assuming that is the case, but it would be difficult for a dentist to get to the facility, and you may be in a state where you don't have a hygienist that can go for you. Being able to train the staff there at the nurses station, so for all the shifts, to be able to use a device and have a delegated device, whether it's a phone or say an iPad, would be fantastic, because they can say, well, hey, Mrs. Jones is complaining of pain on the lower left. Here's the image I took, and then send it, and he can do an asynchronous assessment and send it back and going, yeah, this is just so and so and so and so. It just looks like a mouth ulcer. Here's what you need to do. It'll be fine. Or no, it looks like we've got an abscess, and then prescribe accordingly, and then say we need to make arrangements to get her in. So that would be a huge service to these facilities that don't have on-site or you know, mobile oral health services coming to their facilities. And so then he did have a question about the cost per unit. So you know, either Michelle or Bill, I'll let one of y'all address that in regards to how the TelScope combined with the Teledentix. How that's
and just to reiterate, it's $100 per. I mean, that's a significant discount if you were to buy it all by itself. So if you have a subscription to Teledentix, it's $100 per unit. Let me add to the at the nursing home thing, and you're right, Rick. It is on a state-by-state basis a requirement. I've gone to any number of homes and asked them who's the dentist, and the people that work there have no idea. So they have signed somebody up, but they don't even know who it is to call.
Exactly.
So that certainly works. But there's also Medicare covers institutionalized special needs patients, ISNP patients, and you know, read Alzheimer's for the most part. And so these insurance companies, it's very expensive to deal with a dental problem if that might be an easy one. As you say, maybe there's just something that can be taken care of there. But to actually get these patients, and of course they're difficult to move, very expensive to move. They typically have to be treated within a hospital setting. So if it's something minor, it's something that these insurance companies would like to work with dentists a lot. But to get back to what you were talking about, going to these homes, whether it's schools, whether it's senior homes, whether it's retirement living centers, this is a way for a dentist to expand his or her practice beyond the 4 walls of their office, and where they can in fact do diagnostic services remotely. And then if the patient needs to come into the office, then you work that out. So we see this, and we see some of our customers using this as a great marketing tool, an easy way to get known in the neighborhood without too much effort. It is an ongoing marketing, by the way. You don't just drop it off and then hope they send you something. You know, you need to go back periodically, see how it's going, and so forth. But it is a wonderful marketing tool.
Hello, can you hear me?
Yes.
I got the guy to be quiet on my computer. I wanted to add, I had, before someone stole my iPhone, I was using my my Teledentix light and camera in a group home. We received a contract with the Mills group home, and they're all adults, and they're in a rural area, and they all were special needs, and between the ages of 18 and 35. And it was so helpful, because a lot of them were severely have severe mental issues, but they thought the light was cool. They opened up to it, and the dentist and I both were able to get in and do some great exams. So that it really worked good in the special needs population with adults. It was a great opportunity. And my granddog had broke his tooth, and I was able to take a picture of that and send it to the vet. Just saying, it all worked together for the love of animals. If any animal haters are on here, I'm sorry, but it did work good for my granddog. And I was able to send it to his vet, and everything was okay. So I love Teledentix, and I got my new kit in the mail, my new case for the phone in the mail, and I'm going to be going out using it more often. But I want to say, to me, the biggest advantage, and this always gets me in trouble, is the fact that it's on the phone and it's easy. When Melissa asked the question, what's the advantages? The biggest advantage to me is it's on the phone. Most people have their phone with them, and there's no cords, no strings, nothing to hook up. You just cut your phone on and just go. So that just makes my whole world happy. So I wanted to add that in. Thank you all. This has been a great webinar.
Thank you so much, Sonia.
So it looks like we have time for one more question. McAllister, I know you put one in there, and I think this is probably geared towards Dr. Simpson's expertise. But when you see when you show an intraoral photo to a patient, does that make them more accepting of the treatment? Does it give them a sense of urgency? Do they understand a little bit more of what you're seeing in the mouth?
So I would have to say that I'd have to do that by word of mouth of my general dentistry colleagues. I have a distinct advantage being in pediatrics, that parents and other caregivers and grandparents will make sure their kids are cared for before they're cared for. And I have also the advantage of having the kid open his mouth and have the parent come over and me show it right then. So I'm not trying to convince the child about the care. I may be trying to convince them in how we're going to do it and how it's going to work out, and it's all going to be okay. But I have the advantage of direct vision from the parent. Now, I do have a lot of colleagues that there's no doubt that being able to see the images as they're discussing it, it makes a huge difference in their acceptance of the diagnosis, acceptance of the recommendations and the treatment plans. There's no doubt about that. Now, in thinking in terms of things that Sonia deals with, and some of the other people that are dealing with, where you have special needs patients, you have elderly that aren't making their own healthcare decisions. With the Teledentix app and the TelScope, you can capture the image and you can bring in on video call their decision makers, their healthcare decision makers, whether it's their adult children or whether it is a sibling, and being able to conference with them what your findings are and what your recommendations are without them, they may be an hour away in another city. So being able to provide that, I think it would be is a very comforting aspect of being able to provide that care, is giving them an image and saying, hey, this is what happened. This is going to be okay. This is how we recommend addressing it. And we wanted to get your permission to do that. I think that would be a tremendous advantage in being able to do that for people who can't make their own decisions as well.
Great. Awesome. And then one note too, in the chat, there is a link to our joint website at get.teledentix.com where you can learn more about the TelScope and then talk to our team about, the subscription to Teledentix and a demo and getting that Teledentix or that TelScope price with Teledentix. So with that, we wanted to express our sincere thanks to both Sarah and Jolene for coming on and helping us out from the real world user perspective. And thanks to the National Mobile and Teledentistry Conference and the American Mobile and Teledentistry Alliance for having us on tonight. And I will pass it over to you, McAllister. Thank you.
Thank you so much, Daniel. I apologize. Everyone will have to listen to my dog eat her bone in the background. I am so excited. This was such a fabulous discussion. Thank you, everyone, for sharing your expertise. As we all saw, there's a really great opportunity to not just help connect with our patients, but even connect with other healthcare professionals. I mean, I never even thought about being able to help screen for, like, should we get tonsils out or something for a child? What a really unique opportunity that we can have some cross collaboration and referral with our medical colleagues as well. So I'm sure you all saw in the chat too, Melissa has the link down there, that special link for the discount as well. For all of our attendees, we will send out some follow-up information as well. Make sure you have all those links too. If you do have any more questions about Teledentix, Holland Healthcare, the TelScope, please feel free to reach out to our fabulous panelists as well. We want to just thank you again for taking the time this evening for everyone to join us for such a wonderful discussion.